Okay, hello everybody. Welcome. There were over 500 registrants for this webinar. There's a tremendous amount of interest in this topic. So I'm so pleased to welcome you all. We did have registrants from over 50 countries. Obviously, it's an issue facing all of us. Some of you are very sorry, I'm just going to enable the AI. Some of you are very familiar with heat. So my name is Lissa Ceolin, and I'm Vice President of WHWB International. I'm also an assistant professor in the teaching stream in the Division of Occupational and Environmental Health at the Dalla Lana School of Public Health at the University of Toronto. So I welcome you. I am joined today by Dr. Tamer Khazragui, who's an occupational medicine physician in Egypt. Welcome, Tamer, and he's also a WHWB board member and will be moderating this session. I also welcome Marianne Levitsky, who does so much for WHWB, is also with ECHO and the University of Toronto, and Dr. Pouné Saberi, who's a physician for social responsibility at the University of Pennsylvania. She will be monitoring our chat today. I will introduce our guest speakers in a minute, but first I want to sort of introduce you all. For those of you who don't know WHWB, we are committed to a world where people do not become ill as a result of their work. This means building capacity to manage occupational health risks in underserviced areas, as well as raising awareness and demanding action on critical occupational health challenges. And one such challenge which we're all facing is climate change. The intent of this session today is to gauge your interest and to inform us at WHWB what we can do to help occupational health practitioners around the world manage the growing challenge of occupational injury and disease associated with climate change. So we really want to hear from you, and we'll give you an opportunity after the presentation today to speak up and share your thoughts and ideas and your challenges. So we know that the direct effects of climate change, such as extreme heat and precipitation, drought and wildfires, and warming oceans, as well as all the subsequent changes to both our physical and social environment, are impacting workers in a multitude of ways around the world. So we're just beginning to understand the impacts and scope of the problem, as you will appreciate from this video that we're about to show you from the ILO.
2023 was the warmest year on record. Climate change is changing everything. It is causing deaths, injuries, and diseases for workers everywhere. Climate change is leading to excessive heat, extreme weather, UV radiation, air pollution, and an alarming increase in certain diseases. These are just some of the dangers that are threatening the health and safety of workers and putting their jobs at risk. 2.4 billion workers are exposed to excessive heat at work every single year. And the total number has gone up over 35% over the last 2 decades. Our most recent data shows that over 26.2 million people are living with chronic kidney disease related to workplace heat stress. Excessive heat kills around 19,000 workers and injures around 23 million workers every year. UV radiation is impacting even more workers, around 1.6 billion, and killing 19,000 per year due to skin cancer. In addition, these 1.6 billion outdoor workers may be exposed to air pollution too, resulting in some 860,000 work-related deaths. Outdoor workers are also vulnerable to vector-borne diseases, which kill around 15,000 workers every year. Climate change is leading to an increase in the use of agrochemicals, putting the over 900 million agricultural workers worldwide at risk of exposure. Every year, 300,000 die of pesticide poisoning. Each of these climate-related hazards represents a threat in and within itself, but they are also uniquely interlinked and may result in a cocktail of hazards. The cumulative effect may pose an unprecedented threat to humanity, and we do not have the full picture of the real impact yet. This highlights the multidimensional challenge that lies before us. Climate change is a health issue, It is a workplace issue. It is also a social justice issue. But above all, it is a human rights issue. It needs to top the list of our global priorities. Going forward, workers and workplaces must be at the center of climate change action. Heat action plans must prioritize workers' safety and health. And legislation on occupational safety and health needs to mainstream climate change hazards as a matter of urgency. We are in a sprint to save lives, and the time to act is now.
So as you can see, this is a very challenging issue, and today's focus of the focus of this session is heat. Workers are particularly vulnerable to heat because of the multitude of factors that include long exposures, limited or no access to shade or water, metabolic heat loads that can dramatically increase core body temperature, and for many workers, as mentioned globally, a lack of agency and fundamental human rights. So this is really a call to action. It is a problem that we all face, and I invite you to join us and share your insights after today's presentation. It is now my pleasure to welcome and introduce today's speakers. Dr. William Brett Perkison is an assistant professor at the University of Texas School of Public Health in the Division of Occupational and Environmental Sciences. He is board certified in both family medicine and occupational and environmental medicine. Prior to joining the faculty, he worked as a regional manager in occupational medicine in the oil and gas industry, where he managed the medical aspects of heat stress prevention programs for outdoor workers. And Dr. Ronda McCarthy. Dr. McCarthy is Concentra's Senior National Director for Medical Surveillance Services. Dr. McCarthy completed her residency at the University of Pennsylvania and is board certified in occupational and environmental medicine. She's based in Texas, where she's no stranger to extreme heat and its health effects. And in 2019, Dr. McCarthy was invited to provide testimony on the heat illness prevention research to the U.S. House of Representatives Subcommittee on Workforce Protection. Both Brett and Ronda have recently collaborated on research evaluating the effectiveness of heat illness prevention programs that include employee training, acclimatization, and medical surveillance. Brett and Ronda have both contributed to research on the use of cooling vests to reduce heat stress injury and evaluating the efficacy of personal monitoring devices to detect early signs of heat stress in workers. And following their presentation, there'll be a 5-minute Q&A, and after that, we'll open the floor up for a discussion. So welcome both Ronda and Brett.
Thank you. It's a pleasure to be here. I guess we'll go ahead and get started with our presentation. So we sort of on this initial discussion, we were asked to give a broad overview on really heat stress. And then from this, we hope we can generate discussions amongst you about what specific topics in heat stress that we can go over in more detail in future lectures. But today we're going to briefly talk about heat stress as far as recognition, prevention measures, and management of heat stress. Next slide. And we really, neither one of us have any professional conflicts of interest here. And these represent, although we're members of a larger organization, they represent the opinions only of ourselves and our work groups that we've been involved with, and that this information is free of commercial bias. Next slide, please. So what we're going to do today is we're going to talk a little bit about global reach of climate change, how that works, the impact of heat stress on the workplaces, and then we're going to go into some more specifics about Ronda's and I's own experience with heat-related illness and injury prevention and management strategies. Next slide. So first of all, I like to try to start all heat stress presentations with, first of all, kind of talking from the big picture. I think it's important, as the film illustrates, to discuss that we are developing new strategies to mitigate increasing temperatures. but that those strategies won't work unless we solve the underlying problem of what's causing the temperatures to begin with. And so for many of you, this is probably old information, but I always like to try to have one or two slides just talking about underlying causes of what is climate change, what's causing it. And basically, in this slide is summed up is that ultraviolet light from the sun, it harmlessly goes to the Earth's surface without a problem. But then when it hits the Earth's surface, the wavelengths change. The wavelengths of the ultraviolet light change to between 130 to 150 nanometers. And at that wavelength is what is absorbed by carbon dioxide in the atmosphere, and including other greenhouse gases. And so parts per million among carbon dioxide content can make a drastic increase in how much of that heat energy is retained. And that's really kind of the essence of the anthropomorphic causes of greenhouse gases. There's a lot of other causes of temperature fluctuation, global temperature fluctuations, and that's oftentimes given as a discussion point about what's caused by people versus what are natural occurrences. And in truth, if you look at global temperatures since they began to be measured in the 1860s, you can see fluctuations from decade to decade based on different meteorological phenomena, volcanic activity, et cetera. But you can see an overall trend, and the average is what is important, is going up and continues to go up. And I think as it becomes more evident from meteorological events and natural disasters that this requires less explanation, but I still think it's good to go over with. And then if we look at even a larger time scale, looking at cores from glaciers, if we go back thousands of years, we can also see that carbon dioxide content does fluctuate up and down to various natural causes. But then if you look on the extreme right, it's beginning to shoot up at rates that in any of our measured history of these ice cores is unprecedented. And so we're entering a new territory, we're entering a new type of climate that we really haven't seen, certainly in the history of mankind. Next slide. So if we begin to look at one of the phenomena of climate change, which is heat stress, and probably the most obvious and the one that we're having to deal with on the surface most often, you can see that this truly is a global phenomena. This is a measurement where temperatures have changed to extreme hot temperatures throughout the globe, and you can see that really it is happening on all continents. A dramatic increase in overall average temperatures. Next slide. So we'll talk a little bit about the physiology of heat stress. Both Ronda and myself are physicians, so we kind of approach it from the medical standpoint, but we work closely with industrial hygienists and others. So we try to kind of put the medical physiology flavor of it into this and tying it in with industrial hygiene effects. And so just the terminology of heat stress really refers to the environmental heat exposure, the ambient heat exposure on an individual, as well as the metabolic exposure that results from heavy manual work when we're talking in the context of occupational health. And then heat strain refers to the physiological response to that heat stressor. So the physiological response, so increase in perspiration rate, increase in skin blood flow, all that really refers to as heat strain. And then when we talk about HRI or heat-related illness, is really discusses the symptoms of heat stress that a person begins to affect. So we'll use primarily the term heat stress in this presentation, but just to kind of make the differentiation there. I'm going to turn this over to Dr. McCarthy now, and then I'll switch back here in a little bit. Next slide.
Thank you, Brett. So Brett led into heat-related illness and how that developed. So we'll look at the heat-related health hazards Specifically, the direct health effects from working in heat and hot environments are the heat-related illnesses that many of us are familiar with, that start from the least severe being heat rash, going to the most severe heat exhaustion, which can quickly lead to heat stroke if left unaddressed. Heat stroke in U.S. workers have been estimated to be fatal in 80% of the time, as researched by OSHA. Other heat-related illnesses that are indirect are traumatic injuries, burns that can be associated with the cognitive impairment that occurs with working in the heat, and working with hot surfaces. Renal pathology, such as acute kidney injury that can occur from repeated bouts of dehydration with heat exposure that leads to chronic kidney disease. There's rhabdomyolysis, exacerbation of existing conditions that individuals may have, such as cardiovascular disease, kidney disease that we just said, psychiatric disease, and diabetes. Next slide. There are also the heat hazards also impact employers. Research out of the United States shows that looking at 11 million workers' compensation cases shows that when temperatures reach 90 to 100 degrees Fahrenheit, or 32 to almost 38 degrees Celsius, that there are a 7 to 15% higher risk of injury, respectively, when compared to cooler temperatures. And thousands of these heat-related illnesses can result in days away from work. So this can lead to decreased productivity, not only from lost time or absences, but also just decreased productivity. There is also a study out of India, which is referenced there at the bottom of the slide, that shows a 1 to 3% decreased productivity per degree Celsius after 25 degrees Celsius. So this results in increased cost to the employer. So when trying to talk about providing heat-related illness prevention measures to employers, they're interested in their costs or productivity. So saying that this is something that will, without these measures, it will increase their costs. It will decrease their productivity, leading to increased costs through the cost of illness, injury, employee turnover due to suboptimal work conditions, wanting to go to different jobs, new hire, lower performance, new hire error rates, etc. Next slide. But the good news is occupational heat-related illnesses are preventable. So in the United States, OSHA says that thousands of heat-related illnesses occur every year, many of which are fatal, but they are preventable. And then we don't have time to talk about how to treat all these different illnesses that can occur, but I think it's very important to talk about the illness that causes the most morbidity and mortality, which is heat stroke. And it must be treated like a life-threatening critical illness that can occur. Oh, did we lose sound? I saw that in the chat. That can occur, that could occur at any work site. So it involves rapid recognition. Pre-hospital care is essential with rapid total body cooling. So the risk of organ injury and death decreases as time to cooling decreases. What you want to do is have the training. The training is essential for those persons at the work site for worker survival. So you want to be able to have early identification of symptoms of heat exhaustion or heat stroke, to be able to stop all body activity which generates that heat and provide total rapid body cooling. Next slide, please. This slide here is showing just some research that is out of 2024 research from researchers from Greece, Canada, and Australia, which gives you some just parameters on cool water immersion when rectal temperatures are not available. And here is a picture just basically out of this month's, or just a couple of weeks ago, from Phoenix, Arizona, where temperatures are right now. The heat index in Phoenix, Arizona, United States is like 110 degrees, and for many of the days in June. And so this is an emergency responder using a body bag, basically, and putting ice in the body bag for pre-hospital care. And this has been utilized in San Antonio in Texas for their emergency responder. My son-in-law is actually a San Antonio firefighter, and they've been using that. And they say that they have people that are unconscious, that are sitting up and talking. By the time they get in the hospital, it works so effectively. And so here on the slide, you can show that this research showed that it was 90% effective in exertional heat stroke with these parameters, and cooling the body down to 101 degrees core rectal temperatures, or 38.6 degrees Celsius. And it gives you some parameters on the time to do that. You want to be sure that you're not wrapping them in the body bag without that cold water immersion, because that could add to their heat. Next slide. So looking at, to develop a heat illness prevention program, which we have many, on the last slide, we have many resources and references that can help develop your plan, because this is just a short version here, but you can use this slide deck and the resources and the references on the last slide. But you need to look at the risk factors, and you need to look at the risk factors specific for that environment, the job, the physical activities that the employees are engaged in, and then also individual risk factors. So there are 3 broad categories of risk factors that can increase workers' risk for heat-related illness. So you look at the external, such as the environment, the protective wear that they're working in, indoor, outdoor, and then the internal risk factors, such as the person's metabolic and their physical activity. Do they have moderate physical demands to very heavy physical demands? And then their individual risk factors. Many of these on the slide will show you just a lot of the different individual risk factors. So these factors weigh in on the workers' thermoregulatory system's ability to balance their heat load. And so we will, the employers, you can provide recommendations on the employer's ability to address external and internal factors with engineering and administrative controls. And clinicians, occupational environmental physicians, can help address those individual risk factors with medical surveillance that we will talk about, to either by training, education, or maybe even some providing some restrictions in the work environment. So here, next slide, we will go into the heat stress management program components. So looking at those risk factors, you want to look at the components of your program depending on that environment, the job demands, and the employees' work duties. So first, you want to see if you have a risk for heat-related illness. So you want to measure the temperatures. And then you also want to measure the temperatures on an ongoing basis, so you can guide those employees on the risk they have on an ongoing basis, on a day-to-day basis, because there may be a heat wave, or there's some days that may be hotter or more humid than others. The gold standard is the wet bulb globe temperature, and that's the preferred environmental heat metric. And that captures air temperature, humidity, wind speed, and solar or radiant heat. But realistically, many employers use heat index because that's readily available. And that just is more how the temperature feels. That uses temperature and relative humidity. Once you know that the workers are at risk, then you ensure that you have a heat illness prevention program. Acclimatization is a very important part. We'll look at that in just a second. Training, as I said, for supervisors and employees. It's important for them to recognize what heat illness symptoms are and what they should do should they have any symptoms. Emergency response protocols, just like I said, heat stroke, its time is critical. Access to cool water and drinks, and I would say also access to restrooms. Many employees will not drink if they if they don't have a place to go to the bathroom, and that is very vital to heat illness prevention. Access to shade, work rest cycles, buddy system. We talked about those in cognitive impairments. If a person is having cognitive impairment due to heat illness, they won't know to take themselves out of the environment or seek first aid. So this is very important. There's many others, which some of the resources will go into. Next slide, please. Other aspects are medical surveillance program, personal monitoring systems, so they can tell early on if they're having early symptoms of heat stress to get themselves preventive measures, cooling methods, and also it's important to have stakeholder buy-in from management, and a quality assurance program to see if the measures are effective. Medical surveillance is a good feedback mechanism to know if the controls are effective. If you're having increased number of first aids or heat illness, to let them know if the employers know if their controls are effective. So evaluating employees on their individual risk factors is part of medical surveillance. And those conditions, those medical conditions or medications and other can lead employees to have increased risk for heat illness. So, all employees, with certain physical conditions, they can be very healthy and have a risk for heat illness because they're doing heavy physical demands and in high temperatures. But you can have increased risk due to having certain medical conditions, medications, pregnancy, age, etc. So having those risk factors screened, you can educate those employees on what their risk factors are and know how to address them. And some employees just may be that they are too high risk to work in those conditions. Next slide, please. Acclimatization program I would say is extremely essential. Workers who are unacclimatized to heat stress, particularly newly hired workers and those returning after a prolonged absence, are at severe or at high risk for severe heat-related illness. 75% of fatalities, 3 out of 4 fatalities from heat illness occur in the first week of work when there's not an acclimatization program. So building the tolerance at a very minimum by 20% each day, which has you working at 100% in 5 days, can prevent morbidity and mortality, can prevent fatalities. And ideally, the best method would be to increase incrementally over 7 to 14 days. So there's many different methods to acclimatize workers gradually. And those, again, are in some references at the back of the slide deck. Next slide, please. I'd like to just briefly discuss the outcomes of a heat-related illness prevention program that was implemented in 2011 and going through 2019. And this was a study that Dr. Perkison and myself worked on with other researchers. And the reference is linked there at the bottom. So the heat-related illness prevention program included many of the components that I just discussed, but highlighting training, acclimatization, and medical surveillance. But then, due to some changes in the management at the work site, medical surveillance was discontinued in 2018 and 2019. So this is just showing some of the outcomes on the heat-related frequency and the workers' compensation cost. Next slide. Oh, thank you. Yeah, it's so you guys see it with 2018, 2019 there's without the medical surveillance. Thank you. So with the workers' compensation cost, looking at that alone, we have two time periods. Time period one in 2011 through 2017 with the medical surveillance, training, and acclimatization, and in 2018, 2019 without the medical surveillance. So the median cost per injury was $208, and then in time period two, it increased 5 times to over $1,000 per injury. So it increased 5 times. The results were the significance of these results were impacted by the fewer number of years and injuries. But again, you can see that it did increase. Next slide, please. And this is just a chart of the frequency of the injuries. And again, with the medical surveillance in blue and without the medical surveillance in red. And so at the beginning of the program, where it was implemented in 2011, there was approximately 30 injuries per 1,000 workers. Or if we want to look at when the program was implemented, the frequency rate for the initial years was 9.5 heat-related injuries per 1,000 workers. And then when the established years, here in the next section, it was about 1 injury per 1,000 workers. So if you see in 2016, 2017, there were no injuries. And at that time, that was the hottest decade on record per NOAA. So it wasn't, the temperature did not change at all. And this is Central Texas, very hot subtropical climate. So then in 2018, 2019, when training and acclimatization continued, but medical surveillance, checking those individual risk factors was discontinued, the injury rate went back up to where we had a rate of 7.6 heat-related injuries per 1,000 workers. So this just shows you how heat illness prevention programs in outdoor, this is outdoor municipal workers and in a hot subtropical climate in Central Texas was beneficial in reducing heat-related illnesses. I just saw the heat winning video from Corey Stringer Institute. And actually I have a reference that is very good for employers in a reference from the research done by the Corey Stringer Institute, which is an extremely good reference. And now I will pass it over back to Dr. Perkison on interventions. Next slide, please.
Yeah, thanks, Rhonda. And I'll also add to the audience that Dr. McCarthy personally implemented this medical surveillance program and oversaw it. So she's really got a wealth of experience, personal experience based on practical applications for it. So in addition to medical surveillance, I think that's a strong tool there to have in one's pocket, because one of the issues, I don't know about your countries, but at least in the US, one of the main pushbacks we have is, how will this affect my workers' productivity? And surveillance enables one to not have an impact on productivity. You're not worried about that work rest cycle. Instead, you're doing upfront monitoring and evaluating people for their risks. And so you're maximizing productivity. Other interventions are utilizing personal monitoring devices. And these devices have really become more sophisticated as technology in general has advanced. A lot through the military for troops, monitoring troops on the front line for different physiological changes. And so some of the interventions includes that you can monitor, includes heart rate variability. And so this isn't the heart rate, the pulse rate, it's the variability of how much variability in the heart rate for a given unit of time that you have. And for any of us, for any given amount of time, our pulse rate slows down, it speeds up. But as heat stress, there is evidence that as the early signs of heat stress develop, this heart rate variability slows down. It's thought that the automaticity to the heart is not working as well in early signs of heat stress, and therefore you have less variability. And so that can be monitored on an individual basis. There's also estimates of skin monitors that will estimate using algorithms core body temperature that are really becoming quite accurate. Other factors, accelerometry, so measuring how much exertion an individual is doing, which of course goes into that slide about the metabolic forces that are involved in heat stress and help you alert to people that might be at risk for heat stress. And finally, the respiratory rate, which is also a great way of monitoring. So my own experience with this, as was mentioned, and I've had experience with monitoring heat stress programs in a company environment. And last summer, our research group tried out the personal monitoring device Zephyr it was a small pilot project last summer when in Houston it was over 100 degrees. So it was a good time to test this and to look at the effects of heart rate variability on individuals with cooling vests and then without cooling vests and to look at that. And so we had the employees have these monitorings. You can see it attaches around the chest. We monitored them for a couple hours in the afternoon and just looked at how well this tool might work. And we were actually sitting on the third deck of a platform. These were construction workers in the oil and gas industry constructing platforms, and we were up on the third deck monitoring them. And from a monitoring standpoint, it did not miss a beat on the workers that we were monitoring. There was not any problems with reception. They were all pretty close to us, within 100 yards of us for the entire time. And so that aspect of it was good. And then afterwards, the workers really reported that these chest monitors were not hindering them physically. They were able to do their jobs. They weren't really aware of it. So that was a positive report. And then right now we're analyzing the data. One of the things with heart rate variability is that it's very individual specific. So an individual could have a heart rate variability of 20 and somebody else could have a 60. It's really that change in response to heat that you're measuring from an individual, difficult to have standardized. So if you look in the literature, a lot of this is still very much research that's done in lab settings. And so projects like ours, where you're actually out monitoring workers, those are fewer and far between, but it's something that we should develop. And I would encourage you all, for a relatively low expense, you can have these monitors and to try out some of this technology in each of your own respective areas of expertise, because each of our workplace settings really needs to look at this. And I've thought about, what down the line, what we might do as a proposal for this is, would you want all your monitors to have these chest straps on at a given workplace? That would be challenging. Should you have a few sentinel people out there looking for that? So there's a lot of different things and ways, sort of practically, how do you implement it? But the technology is really nice in trying to recognize heat stress symptoms before they develop into some of the more severe symptoms, and they're harder to reverse. Next slide. So I'll end with our presentation by backing out a little bit, sort of on the global scale again. And I don't think I need to tell the audience that this is a significant problem, that if under this particular model here, the representative concentration pathway 8.5, which I'll talk a little bit about more in the next slide a minute. But if you look at this, this is significantly happening that by 2030, it's estimated that 5% of the global population are will be in regions that without air conditioning, that truly will be in danger of a survivability threshold without interventions being done. So this is that 2030 is not far away. We're probably going to experience some of the same problems that we had last summer. All of us need to put our collective experiences and innovation together to come up with solutions to solve in the short term, while we're trying to solve the problems of the continually warming climate in the long term. Next slide. And then the last slide here, it talks a little bit about RCP, which y'all probably have heard of. And so again, it's representative concentration pathway. And what that represents is that this terminology is been popularized by the Intergovernmental Panel on Climate Change, which is a panel within the United Nations. And it strives to look at sort of a compendium of all the different factors of greenhouse gases, methane, carbon dioxide, the other greenhouse gases, and try to synthesize that into a single number that people can kind of get their mind around. And so that 8.5, or these numbers, the units is watts per square meter. And so it really represents an energy. As I mentioned in that first slide, it's really a question of energy being retained by the CO2 molecules. And so if we have business as usual with current carbon emissions as being what they are, that's what the 8.5 is. And you can see the increase in average global temperatures, how it can go up to 8 degrees and beyond on current pathways. And then there are ways to mediate. We're not going to be able to avoid this at this point, but we can drastically mediate it by just concentrated effort and popularizing, sort of being the voice for our companies, individual companies we represent, institutions, about mitigating carbon dioxide as fast as we possibly can. So I will end there, and thank you for your attention.
Thank you so much, Brett and Rhonda. I'm going to open the floor up for questions. If you have a question, you can either raise your hand or place it in the chat for us, and we will. I will ask Pouné to maybe monitor the chat and call out the questions.
There is a question in the chat. I will read it out. It is from Masood Ahmed. According to the Ministry of Labour, Ontario, Canada, the outdoor temperature during summer season are not high enough to acclimatize workers. I wonder if the migrant workers from countries with hot climate who are exposed to high temperatures for most of the year can be considered as acclimatized. Would they have better heat tolerance than the local population?
That's a good question.
I can take that. Yes, if a worker that was acclimatized, say, to the heat that they were working at in Texas, so they were acclimatized to 90 degrees let's say heat index in Texas, and then they went to Canada, where maybe it was more 80 degrees, or I'm not sure that the temperatures that they're experiencing right now, they would be acclimatized, but you lose the acclimatization starting like 7 days and entirely within a month. So there is a time factor involved. You can reacclimatize quicker. You can reacclimatize quicker than a new worker. So then you can do a reacclimatization to that area within a few days. So I think if they went immediately to Canada, they would be acclimatized.
Okay, great. I don't know if Dr. Perkison wants to chime in, or should I go to the next question?
I think that sums it up. Yeah, no, I think no other comment.
Okay, next question is, how much of the wet bulb globe temperature is safe considering the different risk factors, especially the internal and individual risk factors? And this comes from Victoria Makwele.
I guess by the internal factors, you mean individual risk factors, and how I'm interpreting that as how much of a prognosticator for health is the wet bulb globe temperature, without taking into account individual risk factors, if I'm following the questionnaire correctly. I think one of the things about the wet bulb globe temperature, it really has been proven to be an effective way of truly getting an idea about what are the risk factors in a given environment for heat stress, because it takes into account these additional factors. I think the problem is it's harder to conceptualize that, because the wet bulb globe temperature can really be all over the place for a given temperature outside, based on the humidity and the radiant heat. And so it's harder for people to kind of get their mind around that. Yeah, and I think there's probably a lot of more research that needs to be done each individual, there are a lot of factors. We didn't show the slide, but there are a lot of physiological factors that put one at a different risk factor, and that's it's age, it's pregnancy, it's medications, it's prior history of heat stress. And so really that's where a medical surveillance program comes in. And I think current gradations of an environmental temperature, such as red zone, yellow zone, green zone, that those are probably sufficient for determining what are the risks of the average individual, and then those individuals that are more at risk, those really have to be that's where the clinical provider, the industrial hygienist have to kind of confer and say what levels of a wet bulb globe temperature are we going to allow this individual to work in, and also where possibly individual monitors could come into play to see how do they respond to these different temperatures. It does allow you to kind of customize that a little bit more.
Okay. Yeah, and if you look at the NIOSH's criteria for a standard 2016 exposure to heat and hot environments, there is a section where ACGIH, the American Council of Governing Hygienists, have a chart where they show the wet bulb globe temperatures along with the physical demands, and it's supposed to be it'll show you with like standard clothing, and basically of a healthy person, just a healthy person, with a standard height, weight, and it'll show you how much work they can do, whether they're climatized or not acclimatized. It doesn't take into account the individual risk factors, but you can look at that chart, and that is considered like the recommended exposure level or recommended action level for workers. So that's something that you can look at as well for Victoria and everyone else.
The next question comes from Mary O'Reilly. The question is, I'm intrigued by metafabrics that keep the underlying body temperature surface significantly cooler than the surrounding temperatures. I know production needs to be ramped up to be widely used, but what do you think about the possibility of using metafabrics?
Yeah, I mean, I think if we look at hierarchy of controls, kind of going back to that, we need to think about trying to eliminate people's exposure to heat, doing administrative controls, but personal protective equipment definitely plays a role, because we are not going to be able to entirely eliminate all those other factors. And I think that has a lot of potential that you can change that. I think testing it, and again, in terms of productivity, does it inhibit somebody's work? Making sure that its design enables people to do their work safely would be one of the factors. But I think all of the above, as far as cooling vests and types of fabric, all of these things are needed. It really is a multifactorial issue that needs to be addressed in a lot of different ways. So I think that's a wonderful idea.
Thank you. We're going to sort of, there are wonderful comments in the chat, and I think we're going to take the next 10 minutes to just open up, because many of the people here deal with heat stress as part of their work. A lot of occupational hygienists, physicians, health and safety professionals, nurses. So there's tremendous, there are wonderful comments in the chat, and I think this is a good point where we can sort of open up. We have two questions for the audience on the whiteboard. So maybe, Marianne, if we could switch to the whiteboard and maybe post both of those questions, given the limited time that we have. So the first question being, what heat stress challenges are you seeing in your workplaces, and in the workplace wherever you may live? And we know that we have people from across the globe, so please share that with us. Oh, and while we're waiting for that, Tamer, you living in Egypt as an occupational physician, you're also no stranger to heat stress. Also in underserviced areas. So maybe you can sort of share with us some of your experiences. What challenges you face in your practice. Oh, there's lots of lines.
Yeah, very interesting
You
line.
could
Thank
maybe not try to, if you press on the T on the left-hand side, you can type. That would be good.
Thanks, Lisa,
I
for
think,
that. And definitely the temperatures actually, as we speak now, it's 41 degrees in Cairo. And I'm sure that this is not far away from many of our colleagues in third world countries as well. And facing the heat stress is a dilemma, especially when we're talking about industries that are in for profit, not governmental owned, and talking with management for implementing measures or climate control, like air conditioners, can be costly, not only on the initial investment, but also on the running cost. Hence, trying to formulate or come up with ideas that are low cost, low to invest in, and easy to maintain are actually the prime here. And I also see some questions, and somebody was typing in an example about the mining industry, whereby the heat was actually something very difficult, and that we can relate to because in one of our fabric buildings, the building that actually we have machinery producing fabric powder, the heat was actually too much to bear. And teaming up with the industrial hygienists and HS&E team, we found out that the exchange of the air, as measured by the particles per minute exchange, was extremely slow. And just by installing a set of fans in one area and suction fans on the other, actually helped to reduce dramatically the inside heat and allow for better breathability to the workers. And that was very low cost implementation, considering the impact on the workers inside. Another one was actually just a cooler of water, of course, with accessibility to toilets, just like Rhonda had mentioned earlier, because you would not imagine if you deprive workers from toilets that they will be ashamed and they will not drink to actually hold themselves and not lose the time on the shift or whatnot. Or even if you segregate between workers and contractors' toilets, which is another issue, especially in third world countries, we may face that. Having the contractor toilets far away, for example, than the full-time employees of the company. Or the shade, actually having the corrugated ceiling in two layers and having an air layer in between. So all the solutions that can be implemented in third world countries can go actually either high cost or low cost, and you can have low cost solutions implemented within a week if you want to, or some of them just by having them tomorrow implemented in the workplace, along with others, including the administrative controls by having the regular breaks in between, especially paying attention to fasting months for those practicing Ramadan, which usually comes in summertime. None of us have who witnessed Ramadan in workplaces in third world countries. None of us have missed a fainting person, somebody who's going into syncope or just falling off within a work shift. This is something that we've seen before. And it can be attributed to many factors other than just the heat. The heat is a contributor, but lack of sleep can be another one. Lack of food, lack of hydration. So it's a multitude of things that all affect and the individual employee, and they're all basics pretty much. So thanks, Lisa, for the
Thank you. We're actually quickly running out of time, unfortunately, and we did have other questions, but I do invite everybody to share the resources that they have. And I think this is one of many sessions. There's lots of great issues that have been raised, such as, one's ability to recognize heat strain and the dangers and appreciate the dangers, and that it quickly can become, it can run away, and you can go from mild symptoms to very severe symptoms very quickly. So early recognition, both from the individuals themselves and others around them, to recognize the signs, but also nighttime heat. And the effects of poor sleep on sleep, and how that actually can impact your health in the workplace, and further sort of impact the effects of heat. All of these are really important. I do invite everybody to please share in the chat any resources they have. We will have other sessions and we will share this with everybody. We'd also like to start a working group on heat stress, and so we will be advertising that, because obviously this is an issue that a lot of people are interested in, and there is developing understanding and research around this, and one that is faced throughout the world to varying degrees. I'd also like to sort of thank our speakers as we come to the top of the hour so much for such a great presentation, and for speaking on this topic, and everybody who participated, who weighed in and provided meaningful information in the chat about how to manage this very important issue, this risk that many people around the world are facing. So I appreciate that. Thank you so much.
Lisa, I will also just say that I captured the solutions that were put in the chat, and I put them on a slide, and then I also captured the questions that we didn't get to. There's about 8 of them. Depending on time, we could either type them up and send them to the registrants after the webinar, or depending on how you want to handle it, I can do either one.
So these are areas that are really important, and certainly we can, seek speakers and put together programs on this. I know one of our speakers, Brett, has actually looked at regulatory issues across the United States, regulatory sort of the existing sort of landscape of what regulators are doing in this regard, and I think that's really helpful. And sort of setting minimum regulations worldwide is something that I think is in our future, and needs to be done, because it is something we all face. So at this, I'll sort of, if you'd like to say something or share something, and Pouné's going to post the information that you've posted and on a slide, that would be great. But if anybody, I'll open up the floor to anybody. Oh, this is fantastic, Pouné.
Great, Pouné. Thank you for doing that. Terrific.
You're welcome. So this was the other whiteboard question, and people put in really useful links in the chat, so they're captured here. These can be shared, and then I also didn't want to ignore the questions that were put in the chat. So we can either maybe just kind of like mention a couple more if the presenters want to.
Great. If anybody can answer some of these questions, that would be great. I did also want to mention that the American Industrial Hygiene Association is releasing a heat stress app on July 1st, and WHWB will be getting access for distribution and for testing. So that's something that's really interesting, and that might be of use to some people. So I wanted to make people aware of that.
Okay. I don't know, I can't remember who these came from, so my apologies for not attributing them to the questionnaire. But the first one is, considering the climate change effect, can the radiant heat factor be neglected? And so can we say any heat index that doesn't consider or a heat index are not so effective?
Yeah, I was trying to address that question in the chat, but basically, we were very limited in our time. I mean, we could talk about heat stress and heat stress for, illness preventive measures all day long, or probably for the whole week. And so we were trying to take a large amount of material and just talk about the highlights. So wet bulb globe temperature, which is, air movement, air temperature, heat index and radiant heat. So radiant heat from the sun or surfaces is all taken into effect. Heat index, which is temperature and humidity. The wet bulb globe temperature is better for indoor because you have to take the radiant heat from hot surfaces. Where heat index is the air temperature, and humidity, which can be used outdoor, is really difficult to use indoor. I don't know if I'm quite understanding the question, but yeah, radiant heat is very important indoor and outdoor. But wet bulb globe temperatures are not necessarily accessible. The price of those devices are coming down. But the most accessible is the heat index. For United States, we have the OSHA safety app, which sounds like there's another safety app that is being created. I use it all the time for myself, where it gives you an hour by hour in real time heat index, but it also has resources to administrative controls, first aid and emergency response procedures for in the occupational realm. So I think it is very important. I hope that answered the question.
Thank you. There's a couple of hands up with that. The radiant heat.
Marianne has her hand up.
Yeah, Marianne, go ahead.
Yeah, thanks very much for that, Rhonda. I just wanted to mention there are other heat indices. I did some work in Abu Dhabi, and they use the thermal work limit, which was developed in Australia. So it was pretty interesting. We did a comparison of the WBGT and the thermal work limit TWL, and found that essentially the TWL was kind of more permissive in that people could work, because they probably couldn't have worked if we adhered to the ACGIH limit. I'm not sure it affected people's health, but I would be curious to know, again, probably not much time to get into it now, but if people have experience using other heat indices and how well they work, how well they don't. I think we'd be very, very interested in that. And if we don't have time to talk about it now, if you have any experience and can post it in the chat, that would be great. Thanks.
Oh, thank you, Marianne. Kevin Renton, you have your hand up.
Hi, Lisa. Thanks very much for the nice meeting. Yeah, just speaking theoretically, I don't really have that much experience using the heat indexes, but just, the variability that each person has with sensitivity to the heat, it doesn't really matter whether it's exactly 6.45 at the limit, but I think using it as a guide. So even, so the chest straps, which we learned about, definitely can help direct people to when, their body is actually starting to show effects and learn for themselves. And so it seems to be a wonderful learning tool. That was my feeling on that point. Thank you very much for listening.
Sometimes when if there is limited worker and supervisor training, and if I'm just seeing persons for pre-placement exams, I know they'll be working in a hot environment, I just try to educate them on personal monitoring, how they can, because some people will have a smartphone, and I just tell them how they can monitor themselves by their heart rate, and if they can't take it themselves, by their pulse or the cardiac, just even on the heart rate by their app. And when they can note that they're maybe having early signs, obviously I tell them the headache, nausea, dizziness, etc. They need to, sit, take a rest, etc. But also, how they can do their own personal monitoring, and also before and after before and after shift weight, so they can know about their fluid replacement, etc. But I think, that is because some people may not, be as in tune to their symptoms, and that can give them early signs that they need to address that they're having dehydration or signs of heat strain. And also just to go back on those heat, the heat sensors, et cetera, or the heat index. I usually I think that there is such a wide variety of environments and a wide variety of temperatures that workers can acclimatize to, that really I use the heat index of when to administer, when to apply controls or administrative controls of when you should add in water, training, when you need to make sure you have your emergency response ready, and not say, and also just more preventative work rest cycles. But it's really hard to have the buy-in on like the ACGIH levels. Like you said, nobody be working. So more as like of when to implement a heat standard or heat illness prevention program, because I think there will be no legislative, legislation passed on a heat if we have those action levels or TLVs, or because they're just too restrictive. But if we could at least say, at 80 degrees or at 90 degrees heat index, or the Celsius or the equivalent Celsius, that they begin implementing that, or they're required to follow, but not necessarily, any of the required work rest cycles, but just say that you need to allow, like some of the sports industry that says that you at least have a 10-minute break, every so many hours, or if somebody's having signs or symptoms. Because I agree, some of these would just be too prohibitive as far as actually getting work. So but I think that they can be used to say, do you actually need a heat illness prevention program?
Yeah, which you've shown very nicely in that study that you definitely need it and to maintain it as well. But thanks very much.
Thank y'all for joining and being here.
I think one important point raised is that, not everybody, certainly most people don't have access to monitoring devices. And sort of amongst workers, part of the training should always be having lived in a very hot part of the world, Saudi Arabia, for a few years, where radiant heat was certainly a factor. One thing that's really important for individuals is the recognition of early signs of heat strain. And it's just a feeling of unwellness, and being able to sort of link that uneasiness, a little bit of instability, and just a hot and sweaty skin. And so those are the signs that can quickly sort of deteriorate. And the emphasizing the importance of workers to recognize those signs in themselves and be able to intervene and find rest, find shade, hydrate, find water, and take a rest. I think that's really important. So.
Yeah, and if they take a rest, 10, 15-minute rest, and those symptoms don't resolve, then that's when they need to seek medical help. Or if they notice that in their coworker, or especially if the coworker is acting unusual, to seek medical, and if it's hot outside, to seek medical attention for their coworker. And I train, when I'm training the workers, I said, because they may need to do that for you. And so you want to do that for your buddy. That has been life-saving for many of the employers that I've worked with. So it's so you just want to, yeah.
I believe Marianne has her hand up. Oh, Marianne.
Yes, this is another question really for participants. You may know that WHWB, we kind of see ourselves as having an advocacy role as well as an educational role. And, when I hear about areas that don't have access to the technology that is really necessary to protect people from heat stress, or even something like water, potable water, I'm just wondering if there are opportunities for advocacy for, given that the world is now recognizing what a terrible global problem this is, as witnessed that video from ILO and the 50-degree temperatures we're seeing in India. Is there opportunities for advocacy for better availability of technology, or even simple things like water? Just a question. Again, may not have time for discussion, but if people have thoughts, they can share it with us or put something in the chat. Thanks.
Thank you, Marianne. And I think if anybody wishes to talk about something in particular, I don't think we can sort of put all of this together, but I think it's definitely something that we're going to sit down with and sort of sift through and pull out both resources and areas where WHWB can focus on for this important issue. And certainly if any of you who are still remaining would like to be more involved in this, I do appreciate that. If you let us know.
Lisa, could I put an idea forward?
Yes, of course.
I see that in the chat there's been this a bit of social something injustice, eh? And my feeling about that is, I presume that is what is being referred to as the carbon tax, and how it affects different nations at a different extent. So and I'm just thinking that the idea of trying to reverse climate change, seeing that it's taken 200 years to change 2 degrees, or however many times, but it's taken a long time. It's going to take a long time to reverse it. In the meantime, what are we going to do? And my feeling is that we need to look at short-term measures. So improving building standards for a start would be my first thought when weather hits, and preparing for short-term things, getting people more active in terms of looking after themselves, and of course with working in the heat as well, that would also apply. But effects of weather, and I'm just thinking that maybe Workplace Health Without Borders could deal with something like that. That's not something that's too far ahead, something that can help here and now.
Yeah. Well, I mean,
thanks.
It's certainly there are tremendous. I do teach a course on climate change and health here at the University of Toronto, and there's certainly a multitude of adaptive and efforts that are ongoing to adapt to climate change, and also the whole area of mitigation. It is a vast area to prevent future climate change and reduce fossil fuel consumption. So yeah, there's tremendous opportunity there. And when I say we sort of need to sift through and identify a few priorities where we can make some effects, some change, I think
Yes.
that would be a worthwhile endeavor for WHWB to sort of go and collectively think about for a little bit and then come back and address. So yeah, we'll get back to you. I think Tamer said it in. Well, yeah, stay tuned.
Yeah, so it's more safety than health, but that's what I was thinking about.
Okay, yeah. Well, certainly it impacts both.
Yes.
Thank you. Any other comments before we? I think everyone's sort of had an opportunity to sort of add, both ideas and thoughts. So I'm thinking, any other comments before we wrap this up? If you'd like to speak up, I'm not monitoring the chat as closely as I should, but Pouné, if you see something,
I am.
Yeah,
I have.
yeah.
So the questions that we got to this question up here, and I can share the rest of the questions, and then I also caught all the various workplace practices, or they're more resources that can also be shared with participants.
Yeah. Well, so I think the questions will form sort of things we can address in future webinars. I think it would be great to be able to do that. So I appreciate them all. Thank you. And I appreciate everyone's participation. Thank you. All right. With that, I think I'm going to close our discussion. And thank everybody. Thank our presenters, Ronda, who's still with us, Dr. Ronda McCarthy, Dr. Tamer Khazragui, and our moderator, our chat, excellent sort of chat moderator, Dr. Pouné Saberi, and Marianne Levitsky. Thank you all. Thanks for joining us.